Hello and welcome. My name is Barkha Dutt. You're with The Mojo Story, our independent digital platform that travels to where the story is, quite literally. Today, we broadcast live from a small fishing village in the area of Malad in Maharashtra. I came here today to show how, while we may be focused on the shortages of oxygen, of drugs, of beds, of healthline workers, we haven't been focusing also on the shortages in testing capacity. And what that is leading to is a delay of sometimes 4 days, sometimes more, in people being able to get treated. And in this village nearby was a young woman in her early 40s called Rajeshwari Sawant, who actually died from COVID, but the doctors were not able to administer her drugs that they would normally have administered. They wanted to give her remdesivir, even though opinion is divided medically on whether it works or not, but it's being used extensively. And the doctors could not give her that medicine because there was no COVID confirmed result. So everything is in short supply: oxygen, tocilizumab, remdesivir, ICU beds, doctors themselves, ward staff, but also the capacity to test, which is raising serious questions about whether we have the real time data that we actually need to make an assessment on how we are doing, not just in Maharashtra, but also nationally. But also today, I spent my day inside the ICU of a children's hospital. And one of the main differences between 2020 and 2021, doctors are telling me, is how COVID is infecting and hitting very small children. And before I say anything more, what I'm going to do for our panel and for our audience today is to be absolutely quiet and play you a little clip. It's just 14 seconds long. I want you all to watch it, and then I'll tell you what the story behind this little clip is. That tiny hand is that of an 18-day-old child. I'll just repeat: 18 days. That 18-day-old child is fighting for her life inside the COVID ICU of the SRCC Children's Hospital in Mumbai, where I spent my day today. I bring you some more pictures from inside this ward. Let's play these pictures now. As I said, the main difference is how children, little children, are being hit by the severity of COVID. Last year, they did not typically need hospitalization. But in this ICU ward alone, the doctors on duty tell me that 9 of 17 children who've been admitted since the 1st of April are severely ill. This little baby girl is on a ventilator, and that is why she was trembling like that. She's quite literally battling for her life. There are other children. These pictures where we identify the children are with their consent and the consent of their families. That's Nazneen and Arfia. You'll hear their stories on our platform later. She's recovering, so she's smiling a little bit. Thank God for small mercies. But I've spent my morning looking at these little drawings that children are doing to try and cheer themselves up, but feeling haunted by what I've seen today. Everywhere, a kind of bleakness where doctors at this children's COVID ICU are saying to me that they cannot understand what has happened to the mutations, that children are being impacted in this way. And so we may no longer be dealing with a coronavirus, we may actually be dealing with coronaviruses, because the mutations are playing out in so many different ways. Now, what I want to ask is, can we with any conscience look at the images of our children getting infected in this manner, some of them as young as 18 days old, fighting for their lives? We're in a national emergency. Our health system is broken. Almost everything is in short supply. And yet we are carrying on with our election rallies. We are carrying on with our religious congregations. We are carrying on with our farmers' protests. We are just being unscientific, callous, and plain idiotic. And in this moment when this country should be united, we continue to be divided by ideology, by politics, instead of being guided by the science. So I want to introduce on the program today People who will hopefully guide us using the science and nothing else. And let's bring their names up as we introduce them one by one. We're joined by Dr. Velumani, who, of course, owns and leads ThyroCare. Namaskar, sir. I had a very moving tweet this morning about how science has to be privileged above everything else, and that really caught my attention. We're also joined on the program by Gurcharan, who knows a thing or two on how to study numbers, but also spends a lot of time on public policy as an author and an economist. We're joined from Ahmedabad in Gujarat. Gujarat is seeing a high spike in critical cases by Dr. Urman Dhurv of the HCG Hospital. Welcome, sir. And from Delhi, which is now surpassing even Mumbai in caseloads, is Dr. Ambrish Satwik from the Gangaram Hospital. We'll be joined by other voices in this program as we go along. And I want to start with you, Dr. Velumani. I'll have a proper report from inside that COVID children's ICU, which has disturbed me enormously, and it has taught me that we are dealing with something that we do not fully understand. When you went on social media today to urge, please pay attention to science, please let's talk about vaccines and not about temples and mosques. This is not the time. And we see today the Prime Minister having to convene a meeting on monitoring oxygen supply. It is in acutely short supply. I can testify to this personally, having visited hospital after hospital. Dr. Velumani, as a doctor and someone leading ThyroCare, your thoughts today, sir?
Yes, we were caught totally unaware. Individuals can be caught unaware. Even group of some doctors can be caught unaware, not the government. This virus gave enough of period, 1 full year for you. Now, it came down. We don't know how the first peak or first wave came down. Was it manipulated? Was it real? It was a herd immunity which brought it down, is what everybody claimed. But if it was the herd immunity where it vanished, does it mean that this strain is not listening to that antibody? If this is not listening to that antibody, today we are in a totally different situation. Maybe in January, when elections were announced, it looked like the country has only 100 deaths per day. Today we are crossing more than 1,000 a day, and elections are yet not over. So somewhere my mind felt that one side you tell lockdown, other side you run millions and you show to the public that I could gather more people than my competitor. That is obnoxious. Swimming pools are kept closed, but millions are in a religious event getting together. No, that is misguiding completely. Government is losing trust. WhatsApp universities are ruling. Credibility of information coming from credible sources is missing. So I was quite disturbed. So I thought I will make a tweet, but I think it got a good attention. I'm happy. I used the word election and I used the word masjid and mandir only to get attention, not in a political contest.
I understand that, but can you talk a little bit about the mixed messaging, Dr. Velumani, that on the one hand, lockdowns and on the other, lockdowns for citizens and rallies and congregations for everybody else. This mixed messaging, what impact, Dr. Velumani, will it have on our fight against COVID?
I think looking for an MLA canvassing by the Prime Minister, Home Minister is not appropriate when the country is having such a severe distress. How do you recalibrate? You should take quick decision, correct decision. You cannot just tell that, I have announced election, I can't stop it. Anything can be stopped. We stopped the country with 4 hours notice, entire rail, road, air, everything we had closed down. Today, we are having much worse situation than what we had on March 24 last year. So it needs very, very important, very quick decisions, judicious decisions. And I will only alone take a decision is not going to work. You need other opposition parties to agree with it. You need even scientists, clinicians, everybody. There should be a think tank taking a decision, and the leader should be announcing, not WhatsApp universities. Social media has completely demoralized. We have allowed that to happen because we don't have a credible information coming from the ruling or the governing government.
Yeah, I think that's well said in the sense that our communication strategy is so flawed. I don't know what we are trying to tell people. We are either trying to tell people that they should stay at home, but if you're trying to tell people that we should stay at home, why are we canvassing for elections? Why are we talking about, Ramzan and mandirs and Kumbh and Vaishnu Devi and God knows what else. Dr. Satwik, I met with an intensivist in a COVID ICU in the last 24 hours who said to me, and she folded her hands and she said, I beg you with folded hands, can you tell people their festivals can wait? But every time you try and raise this issue, if you're a opposition supporter, they point to Modi. If you're a BJP supporter, they point to Uddhav Thackeray. And lost in this political nonsense are lives now not just of adults, but potentially of children. That image of that 18-day-old baby shook me. And to meet parents, this hospital allows parents with their children. They're bending COVID protocols because they're like, we cannot have traumatized adults in this hospital. And yet, look at our messaging.
Yes. It's a standing disgrace. And I think there's nothing that any of us can say or do that is going to assuage the tragedy or change any of this. But my submission here is that the governing classes are suffering from a kind of pandemic illiteracy. And I think Dr. Velumani is perfectly right when he says that this is fundamentally a communications problem. It's a messaging problem. And when I say it's pandemic illiteracy, because we don't understand what exponential growth means. You have news coming in that about 2,000 people in Haridwar have been infected as a result of the Kumbh Mela. But I'll give you an analogy, a visual analogy of what exponential growth is. And this was an education for me, which is why I thought it should be shared with your viewers. Think about it. This is a thought experiment. Let's say you're sitting in a football stadium, and this football stadium, for whatever reason, is completely watertight, and you're sitting at the top of the stadium and you're overlooking the bowl of the stadium. And this football stadium is filling up at the rate of 1 drop a minute. Okay, but it is exponential growth, which means that every second minute, this is going to double. So 1 drop in the first minute, 2 drops in the second minute, 4 drops in the third minute. So how much time do you think you have to get out? And I'll give you the answer. Let's say you're sitting at the top of the stadium and the water starts filling it at 1 p.m., the first drop. At 1:45 p.m., you have water that is filling up to the first level of the spectators' seats. Okay, so 93% of the stadium is still empty. Now, this is 1:45, sorry. 3 minutes later, which is 1:48, half the stadium is completely full. And 1 minute later, which is 1:49, the entire stadium is full. All right, so what people don't understand is there is a parallel with pandemics. This is exponential growth. So what you're seeing, this is precisely why we didn't get time to react this time. This is complete illiteracy as regards the dynamics of transmission, what the meaning of exponential growth is. We have an article that was released by Lancet, I think just a couple of days back, where there is overwhelming consensus that this is airborne. We still don't have enough behavior change messaging about how to prevent person-to-person transmission. What it means when you say that COVID is airborne is that you've got aerosols that are suspended in an indoor space for a long time. It's like someone smoking in the room, and if a third person were to enter, he can still smell the smoke. That's precisely how the virus is behaving. You need to know how in our metropolitan areas, where the per capita living space index is 48 people per square meter, is less than a prison cell in America. How do you prevent transmission in such circumstances when our population density in our metropolitan areas is upwards of about 12 to 13,000 people per square kilometer? How to use the masks correctly? What kind of masks to wear? There seems to be some monkey brain that seems to kick into action when two people are interacting and trying to speak to each other. They seem to believe that you lower your mask when you're speaking to someone else. Basics of messaging are not available. That's, the amount of capital, the amount of time, resources, and energy we spend on political advertising. Just get some, you can get the smartest advertising people to get the right messaging across. The right communication medium is important. So if you ask me, it's pandemic illiteracy, and we should swing into action right now with messaging.
Yeah, I couldn't agree with you more, but let me just get Dr. Velumani to jump in with a quick comment, and then I'll come to Gurcharan and Dr. Dhurv. Dr. Velumani, what is the one biggest thing that is missing? You spoke about WhatsApp universities instead of cohesive communication. What is the one biggest gap in our policy framework or our communication framework right now, according to you? Just let us unmute you. Can we unmute him, please, sir? Yeah, go ahead.
Things are happening. This is a single virus happening every country. There should be one governing agency for the entire globe for virus. Instead of that, we have every country decides something. In every country, there are 25 states. Every state is deciding something. Every state has got 25 districts. It's too much of subjectivity, too much of confusion. So in my opinion, the government should have a huge research group which reads, understands the numbers, why Maharashtra has got 1/3 of death in the total country, what is wrong with that state. Every state has to be studied, every city has to be studied. I must tell you, in 1 year, we must have learned a lot and disseminated that to the appropriate people. Today, about vaccination, no one knows whether it is safe or not. No one knows whether it is efficacy, having it or not. Even availability is a secret. Jo mangta hai usko hi milta hai. There doesn't seem to be any logic. I must tell you, we have completely mismanaged the 1 full year. And the second wave was not expected this big by common man. But if you look at 1920 influenza, the second wave was 10 times bigger than the first wave. So why is that government did not look into get the figures, be prepared for it? We celebrated too early. That was not right.
I'll just differ with you on one thing. I don't want to question the safety of the vaccines. I agree that more transparency is needed. But I do think that we need to encourage more people to vaccinate, but there's certainly no transparency with why, we are not vaccinating more people. And one of the things that the doctor in charge of the children's COVID ICU said to me is that we urgently need to vaccinate children. That is her opinion as a pediatrician. Dr. Shashank Joshi, the member of the Maharashtra Task Force, is joining us. Welcome, Dr. Joshi. I'll just come to you in a moment. Gurcharan, please do go ahead. What a mess our communication is on this. How do we talk about elections and religious congregations and panchayat elections and then want people to stay at home and follow lockdowns? Is there one rule for one set of Indians and another rule for another set of Indians, and no respect for doctors? More than 800 doctors have died at the front lines of this battle.
The coronavirus should have given our country an opportunity to be one people. And to me, the root cause of this communication failure, if you will, but a bigger failure, it's not just a scientific failure. It is the fact of a tragic divide that has occurred in our country. And our politics is tribal political parties who are engaged in uncivil wars. We are living in an age of hatred. And they are each, you see the electioneering, that you feel that each of the parties are living in wholly different realities as they are determined to annihilate each other. And so I feel that, yes, democracy accepts differences and dislikes, allows room for protest and disagreement, but there are always basic rules of cooperation. And especially when we are in a national emergency again, you should, those rules of cooperation should spontaneously emerge from the people. And so I personally think that these animosities are extracting too heavy a price. And frankly, uh, I feel very, very sad about the situation. And and uh, and I hope one, that this particular uh, age of hatred, as I call it, will will diminish. I mean, if COVID could not bring us together and make us feel like one citizens, you know, here we are, people dying on the one side, and look at what they're talking in the rallies and the
Yeah.
and what's engaging the lives of politicians. I mean, it's really very, very disturbing.
I mean, I just don't know how politicians can look at these images, mass cremations coming in from across the country, a lack of transparency in the death data, the official numbers released by states on their mortality is not matching the number of people who are being brought in for cremations and burials. At cremation grounds, space is actually running short. I met a man at a cremation ground yesterday who told me, "Na अस्पताल में जगह मिलता है, ना शमशान घाट में. Neither can I find place in the hospital, nor can I find place at a cremation ground." Gurcharan, you wanted to say one line there?
Yeah, I just one quick one, which I wanted to say, that we did a reasonable job of providing food and shelter during the first part of the first wave. We've got to renew that now, and particularly that Manrega, which we doubled the outlay, which was really a savior. Now we need that urban Manrega in the urban areas. I think, I mean, the same money that could be saved could be put here, and I think it would, and we should resume that disaster relief for the people. Apart from, of course, making sure we just clear all the international vaccines, make them available. In fact, I would go and make contracts with, just fly them over. It's going to be tough because all countries are begging for those vaccines, because we don't have enough vaccine.
Well, I just want to say we lost critical time on those vaccines. We lost 2 months on clearing Sputnik. We finally cleared the way for Pfizer and Moderna. It's going to all take another few months. Meanwhile, this country is quite literally gasping for breath. In hospital after hospital, oxygen has run short. High flow oxygen is a key part of the treatment of COVID, which is which can impact other parts of your body. But please forgive me, doctors, that I'm explaining this. I'm doing this for our audience who doesn't understand, not for all of you, obviously. Dr. Joshi, how short is Maharashtra on oxygen? From what I understand, you've already used more than you produce. You've been trying to ask neighboring Gujarat. Gujarat has a high number of critical cases. The Prime Minister today is doing a meeting on how to get oxygen from the east to the west. This is how unprepared we are. This is how much of a crisis this is. Dr. Joshi, please go ahead.
So, Barkha, I'm quite sad because, health has always been a very poor priority in across the world, and India is no exception. And we have spent precious little in building our public health infrastructure or private health infrastructure. And it has always been reactive, not proactive. It has always been curative and not preventive. And we have consistently ignored our public health, and which is why we are where we are today. Even after the first wave, we were not that we were complacent. I think we clearly anticipated that there will be a second wave. We know that history from Spanish flu. Clearly, Maharashtra is gasping for oxygen. There are many geographies within Maharashtra which are trying to make oxygen available. What we are trying to do is make our medical community sensitized to rationally optimize the usage of oxygen. We are trying to get oxygen from oxygenators for mild cases through concentrators. Those people who need 2 liters, 4 liters, 6 liters, we can trap them. We are now, trying to, go to collaborate with our CSI institutes like Dehradun Indian Institute of Petroleum, which actually makes oxygen from the atmospheric air. And we have a lot of Make in India, Made in India solutions. But by the time all this will happen, another couple of weeks will be lost. So I think we definitely need a better disaster response preparedness. We all need to work as one India. We cannot be fragmented here. State, unfortunately, is a dual subject, central and state. And I think we need to do this on a war. We are at war. We are at a war
Yeah.
with an invisible virus. And unfortunately, we are not serious about health. And despite of all this, you see the lack of masking, inappropriate behavior even today. And it's extremely sad and tragic that human behavior is refusing to change and people still are into a blame game rather than helping each other and pulling us out of the woods. We people, there is everybody's trying to score a brownie point against each other, and that really saddens us. I think we need to boost
Yeah.
our frontline, our healthcare workers. I also feel a little skeptical about, though we have some world-class economists. I think it's not only about economy and livelihoods. If lives are there, then there will be livelihood. And I think right now what has happened is that we need to balance both. I don't deny that we don't need to balance livelihoods, but we go into extreme posturing and extreme panic, which is completely avoidable and avoidable. So I think right now there are two silver linings. The first thing is Mumbai and Maharashtra is showing early signs of plateauing. We have picked up our testing potential. We probably have maximized our threshold for testing, and probably I got a very nice conversation with a doctor from Nanded who said for the first time in the last 5 to 7 days we are seeing a little flattening of the curve. The ICUs have beds available. Mumbai last 5 7 days has seen a test positivity rate fall down from 28% to 18%. So we are seeing early signs of flattening, and we wish and hope that we can flatten the curve. One more thing
I
we understand.
1 minute. 1 minute. I have to ask you on this because I'm actually in an area in Malad where I met. We met the family of a woman who died. She's 41, and though she got admission in a jumbo COVID facility, she never got a COVID test result in time, and she died. And the doctors did not want to give her remdesivir and so on because they did not have any empirical confirmation. There was no RT-PCR test available. From what I am able to gather in testing centers, and Dr. Joshi, this is not true just for Mumbai. This happened to me in Delhi also. I had to do an RT-PCR test to come here, as you know. There are gaps now of 3 to 4 days between the time you test and the time you get the result. Those 4 days can be critical to how a patient is treated.
Absolutely, Barkha. I think there are two things in our pool: suspect COVID and asymptomatic COVID. Both of them are hidden, invisible dangers. If there is a suspect COVID, we have to treat. I don't think we have the time to wait for a result in a bureaucratic way. Neither do we have the time to, tell the asymptomatic COVID that in 1 week you'll be good and done. What are the two challenges where we need to save lives? Our younger population is getting COVID. They are asymptomatic in the first week. In the second week, they feel they have become okay. So COVID timetable and clock is 2 to 3 weeks. That's a clear cut. And they need to keep monitoring a simple pulse oximeter, 6 minute walk test, and start steroids on time and be digitally connected with the doctor on the phone. That's all they need to do. And somebody has sent a test, eternally waiting for those results. And my good friend Dr. Velumani is here. It's not easy. It's not easy to, we have some of the finest labs which can turn around this in 12 hours. We have technologies like the dry swab technique where the whole RNA extraction process can be taken out. You can do a rapid antigen test. There are so many other innovative ways to understand, and suspect SARI should be treated. And even in the BMC, there is a facility to treat suspect SARIs. I think if in doubt, treat. That's a standard medical dictum. And I think that has to be followed. It's very tragic to understand that some people have died. And it's really, we feel sorry for that. And sometimes an apt administration of steroids is very necessary. Unfortunately, what's happening is steroids are either started too early or too late. And the
Yeah.
right time is missed out. COVID is all
So,
about timing. It's
yeah,
all
but sir,
about timing.
I just want to say to you, I mean, you don't need to hear this from me, is that many drugs are not available. There's no toxlizumab. I can still not pronounce it properly. There's no remdesivir. I'm not a doctor. Doctors are divided on whether to even administer it. And Dr. Deshmukh, who's the dean of KEM Hospital, his words just haunt me. He said, today we're discussing the shortage of drugs and oxygen. Tomorrow there'll be a shortage of doctors. So, Dr. Velumani, you were wanting to come in briefly, and then I'll go to Dr. Dhurv on the testing issue, I'm sure. The huge gap, people saying to us that some laboratories are even refusing to collect samples.
Two things which went wrong. In the first wave, the month over month growth was around 50%. So we had time to scale up. And then in January, it came down, it was only 20% capacity utilized. But within 8 weeks' time, it is week over week 100%. And today we don't have a capacity. This is one thing went wrong, is the speed of the infection. Number two, for the sick care, we have a capacity. But we don't have capacity for travel-related RT-PCR negative tests. And on the top of it, government declared you must have a negative RT-PCR to work in office. That was on Wednesday. Wednesday, Thursday, Friday, these 3 days were horrible in the city of Mumbai. I want you to understand, today it is little better.
Yeah. That's a very important point, because what you're saying is that we cannot afford to be asking for these tests for going to work and to catch a flight, because we're in the middle of a pandemic. Is that what you're saying, Dr. Velumani? We
Exactly.
cannot be doing
First priority
our
is for the patient.
Yeah, I agree. I agree. But we have to find another way, because we're not locking down. So, since we're not locking down, and I'm not a fan of lockdown, so I should caveat that as well, because I just think, what do we achieve? The moment you open a lockdown, the numbers rise again. Dr. Dhruv, if I may get you in, Gujarat is seeing a high rate of critical cases. In fact, we were discussing on the program yesterday that Gujarat's oxygen consumption is quite high and not proportionate to its caseload. And that is because the kind of cases you're getting are much more critical, maybe a high level of comorbidities and so on. Please do jump in. What are the biggest challenges that you're facing on the ground? I know doctors and health workers are exhausted. I can see the exhaustion on the faces of the doctors on this panel and at every single ICU I've been to. Dr. Dhruv, please go ahead.
First of all, a caveat. I'm neither an epidemiologist, neither belong to any political party, or do not support any political party. First thing first, remdesivir is not a life-saving drug. So if somebody says that because of lack of remdesivir somebody died, I would not agree. I am managing corona for last 1 year. So as Dr. Shashank rightly said, steroids could have been given and nobody dies because of absence or lack of remdesivir. So I do not agree with it. Number one. Number two, I've been telling this story for last 1 year, ever since corona started, that the the control of corona is not a duty of government alone. I've been telling this story for last 1 year, which every one of us has heard, that a king was suffering from lot of sunlight. He said, "जब बहुत धूप है, I'm feeling very much fatigued and cover the sun." Lots of people came with lots of curtains. Nobody could do it. Ultimately, a small child came and brought a chhata, an umbrella, and said, "Cover yourself." The only way the government has failed is, if at all we want to say, is failure to explain to the patient that this is going to last long for 2 years and you have to protect yourself by SMS.
What about the failure? What about the failure to stop election rallies? What about the failure to roll out vaccination on time? What about the failure to not have oxygen supplies? I'm also not a supporter or a defender of any political party,
Should I
but we
should I
have
go ahead?
failed. Yes,
Should I go
please.
ahead? I'm
Please.
answering every question. And as I said, I'm not against Barkha Dutt. I'm not favoring any political party. Just because I'm in Gujarat, I'm not favoring BJP.
I
Absolutely
didn't
not.
say that.
So,
I didn't say that.
don't
I'm
think
holding
so.
all parties responsible.
But,
Every party is
but,
campaigning in Bengal, not just the
but,
BJP. Every
but,
party is campaigning in Bengal.
but
Every
I would
party.
now let me say. Now I will
Yes.
remind Dr. Shashank is a close friend of mine. He stays in Mumbai. Every year for last 20 years, whenever there is an excessive rainfall, we go on crying about the failure of the structure, but we cannot do it because the certain infrastructures are created with a fixed capacity. Health worker or health capacity of India was created with a certain maximum limit, and probably we have crossed that limit 10, 15, 20, 40, 50 times. Now, suppose a person goes to a rally or person goes to a stadium or a person goes somewhere else. If he wears a mask, if he tries to be a little bit away from the persons, it would not happen. 60,000 people were there in Motera Stadium. Only 3,000 of them got the COVID. So it is, I'm not saying government is doing everything perfectly. Absolutely not. I agree with everything what you said. But at the same time, if you protect yourself, remember the respiratory viruses are going to go on changing, mutations would be there. This is happening even with influenza virus also. But every virus that comes, whatever mutation across the world you say, none of them can penetrate your mask and 6 feet distance. So, to me, protect yourself today, tomorrow, after 1 year would be the first thing that a media government should apply. They went on saying that SMS is important, but they could never say that if you don't go for SMS, what is going to happen. So, first thing first, prevention, we were a total failure. Even till date, it's a total failure. When you look at the Zydus hospital, where there's a long line of 500 people standing for remdesivir for their near and dear ones, 50% of them have not worn mask, meaning thereby they themselves would require remdesivir within next 1 week. So we still do not learn after this. That's number one. Number two, as far as the situation in Ahmedabad and Gujarat is concerned, probably we are reaching a plateau in next week. uh, Fortunately, at least Ahmedabad was reasonably prepared, or we can say that we had a MOU between the municipal hospital or a government hospital vis-a-vis private hospital last year, and the same worked wonderfully. Third thing, Ahmedabad last year went on to manage about 60% of patients at home. So most of the health workers were absolutely prepared doing it at home. We were the first to do the jugaad of giving
Okay.
remdesivir at home, and that is helpful
Do you have
to
enough
Gujarat.
oxygen, sir? Do you have enough
Yeah,
oxygen?
that is the last. That's the last thing I was talking about. Bhavnagar is producing about 60% of oxygen in Gujarat, and it is working very well. So at present, till date, we don't see the problems with oxygen. But yes, if this goes on, probably next week, but not at present.
Okay, I just want Dr. Satwik to respond briefly to this, and then I want to actually play out for you what a pediatrician in a COVID ICU for children said to me. Dr. Satwik, there's been a whole lot of debate over whether social behavior, in some ways, we the people have done this to us, and we the people have to save ourselves. In fact, Dr. Gadvi from Gujarat was saying on this program yesterday that politicians won't have the guts to stop all this. So it's going to have to be civil society. But there's a flip side to this. We are in real danger of civil unrest. I have seen hospitals where crowds have gone in and almost beaten up doctors because oxygen has run short. And I don't think we're understanding the kind of tensions that are simmering beneath the surface. That's a video from Vinayak Hospital, 1 hour away from Mumbai. Dr. Joshi would know about it, where 8 people died in one day because the oxygen ran out. And it's not the doctor's faults. It is not the fault of the doctors. But this is what is happening with doctors. Dr. Satwik, please go ahead.
Yeah, I think we'll have to understand that human resource is the most precious resource. And therefore, we'll have to be sensitive to human resource in our handling of medical and paramedical staff. We'll have to be extremely sensitive. But, in the Greek tragedies, they had a very clever device, which was to keep all horrific occurrences off stage. They used to call it off scene. All right. And that's the dubious kind of etymology of the word obscene. Something is an obscenity. All right. And what happens is that there is a kind of negative feedback loop. It's only when you see disease-riddled corpses on stretchers outside of casualties is the negative feedback loop set into motion. That's when people start realizing that these are the appurtenances of the epidemic. This is going to harm me. That's their first consideration of their own mortality. Now, I will reiterate that persuasion is a communications problem. I don't want to say anything excoriating against the government, but think about it. Nobody knows that 40 to 50% of COVID transmission can happen before the person turns symptomatic, when there are no symptoms. People need to be told that. A lot of people don't understand that the emphasis has to be on masking with an airtight seal in indoor environments and not the fetish about sanitizers and hand washing. This do gaz duri doesn't work in indoor spaces, particularly air-conditioned environments. This is an attitudinal problem. This requires a very specific kind of education, a very specific kind of literacy. And this needs to be, that's the importance of messaging. Also, I think you've been playing out the clips of children on ventilators and children with pneumonias. Well, there are a few things that I think I'd like to state. First is we have to recalibrate our understanding of pandemic-related herd immunity, and we have the example from Manaus in Brazil that will guide us there. We had a sero survey in September which mentioned about 76% seropositivity in Manaus, and then it started raging in January like never before. So that was the kind of final nail in the coffin of disease-induced or infection-induced herd immunity. So it's entirely possible that new variants might emerge which might be able to escape convalescent antibodies, and reinfections will be very common. It's entirely possible that these new variants will not be neutralized by vaccine-induced antibodies. And therefore, we also need to recalibrate our vaccination strategy, because in Brazil, Sinovac, which was the vaccine they've been using, is practically useless. So they will have to recalibrate their vaccination strategy. The same goes for us. The real world evidence of the vaccines we are using in India is at least seemingly dismal in terms of not being able to prevent disease. We will need full data, not just anecdotal data about how effective it is against preventing moderate to severe disease and hospitalizations in the fully vaccinated. But it's not inconceivable. There are many.
Why are you feeling less than optimistic that those who've been vaccinated and then got tested positive may not have been much worse had they not got vaccinated? You seem to be sharing Dr. Velumani's skepticism about the vaccines.
No, I'm not sure. I mean, it is a kind of.
I think they're all wanting to come in, but you make your point, Ambrish, then Dr. Velumani, and then Dr. Joshi, and then Gurcharan. Go ahead. Yeah.
Right. So all we have now is anecdotal data, but I think all of us who are doctors have had, scores of instances where people who've had both their shots of vaccines have easily contracted the disease. Some of them have required hospitalization. Some of them have developed severe and moderate COVID. But what I'm trying to say is that it's not inconceivable, because there have been studies which have established that Pfizer BioNTech vaccine is not able to neutralize the Brazilian variant, B1. In vitro neutralizing assays.
But the virus can mutate for years, Dr. Velumani. We can't live in a lockdown world for years. We can't. It's not possible. Go ahead, Dr. Velumani.
It is only vaccine that can give the exit, nothing else. I'm very clear on it. Only concern is one or two sporadic incidents the WhatsApp universities are amplifying, and the credibility of the vaccine and vaccination is made questionable, and people initially were refusing to go for vaccination. Today it is surging, and people are asking, Mera kidare, Mera kidare. So this is one thing I wanted to mention, not credibility of the vaccine I talked about. And let me also second what he said. You finish entire 1.35 billion people vaccination. Who knows? If the vaccine mutates, you have to go for once again 1.35 billion population with the new vaccine. Don't be prepared for it. It can happen. And let me tell you, it is 400th day of the virus management. The medical and paramedical staff have completely fatigued. There was no holiday. There was no Gudi Padwa holiday. I must tell you, I feel ashamed of looking at my workforce. So it's going too much. But let me conclude by telling this. Without food, you can wait even for 3 months. Without water, you can't even wait for 3 days. Without oxygen, even 3 hours is going to be a hell. We are into the final stage. If we have to import oxygen for the country, we are caught unaware of. It's important that all get together, sit down, find out priority, only life first, rest all will be next.
I agree. I fully agree. Dr. Joshi, Gurcharan, please do go ahead, and then I want to go to the children's COVID ICU report. Dr. Joshi.
No, I'm very clear about the things on vaccines. The first thing is that these are all first generation emergency use vaccines. So when you use first generation emergency use vaccines, whether it is even Pfizer or Moderna, I think they are not great. Okay, let me be very clear about it. Whether it is Pfizer, Moderna, or whether it is our homegrown Covaxin or Covishield, we don't have robust data. We have all fast-tracked these vaccines, but one thing is very clear-cut, that they save lives. And I don't agree with my colleagues here that they are not life-saving. They are clearly life-saving, and they definitely will take the sting out of the disease. So vaccinating with what you have is mandatory. Vaccination will have adverse events. Vaccination strategies will change. Just like we have a flu vaccine which is quadrivalent, you might have a pentavalent vaccine for this thing. It's in an emerging stage. These are first generation vaccines. You will get second generation, you will get third generation, you will get more research, you will get more genomic strains, they'll all get imbibed in it. But vaccination is something, I agree with Dr. Velumani, must be done. Second thing is, when we are gasping here for oxygen and basics of supportive care, when we are scrambling for beds, okay, we are still not masking. The strongest vaccine is still masking, and there's no two ways about it. And we need to give health a priority. People want to look at people on the streets for livelihoods, but they don't want to mask. I mean, this is completely crazy and insane. Even today, health is the last priority for everybody till you are about to die. That's very unfair to the healthcare in general. And I think that's a shame. And I'm ashamed of this, that even today, everybody across board, across all sectors, feel that health is not a priority, masking is not a priority. It is something very to be ashamed of or something like that. And that's really tragic.
Yeah, I agree. And I just want to request Dr. Dhurv and Gurcharan to just stand by. I'm going to take last comments from all of you. But what I want to say is that when children start getting infected, and Ambrish made a reference to this, in Brazil, they're really dealing with it. In Brazil, babies are dying from COVID. What we are seeing in the children's COVID ICU here is that children are not dying, thankfully, but they're getting much more severely infected than they were in 2020. The pediatrician that I met in the ICU at SRCC hospital today said children must be vaccinated. This false divide or waiting for a children's vaccine, in her opinion, is a waste of time. She's saying schools cannot open. We're not even talking about these things. So here is Dr. Sunu Udani, an excerpt from her interview at the SRCC Children's COVID ICU. This little baby that you see on your screen is only 18 days old and is battling COVID. We are at this point inside the COVID ICU of the SRCC Children's Hospital run by Narayana Health. I have here with me Dr. Sunu Udani, who's going to be talking about one of the big untold stories of this pandemic, the main difference between 2020 and 2021. And it's not good news. Younger children, infants, literally toddlers are getting infected. Doctor, tell us a little bit about the baby we just saw first, 18 days old and battling COVID.
So this baby came to us at the age of 15 days, actually came from out of Bombay and obviously traveled quite a distance to come here. What we have in this baby is a very, very severe pneumonia. And also because of the pressures that have been required to keep her oxygenation going, we've actually had to put tubes because she had a burst lung. And unfortunately, she is really fighting for her life. Now, COVID is not known to go from mother to baby through the placenta like we have HIV or other diseases. But we do know that horizontal transmission, which means from family members or a mother herself, or maybe even from a hospital environment, they do get infected from that.
And you're saying that this little child, this newborn, 18 days old, is critically ill?
She is. She is critically ill.
And literally fighting for her life?
Absolutely. This ventilator that you see is a very special ventilator.
This one, can you tell us a little bit about it?
It's like you see, this is not normal in and out air. This is called high frequency oscillation. And it just wiggles the child. And it's a different method of ventilating. And the very fact that you see this child on this ventilator means that her lungs are really, really bad.
And I could see the baby's hand and the baby's chest actually trembling, that tremor. Is that tremor the lungs, or is it from actually the ventilator?
It's from the machine.
It's from the machine.
It's from the machine. This is called high-frequency oscillation. So the oscillations cause the wiggle that you're seeing and the tremor. It's not coming from the child.
Well, it's just a heartbreaking moment, Doctor, as we walk through this ward, to consider the fact that there's an 18-day child who's battling for her. It's a girl?
It's a girl, yeah.
For her life. And what I want you to talk about a little bit is what's actually going on in the ward right now in terms of what you're seeing as the difference between last year and this year in how children are getting impacted. And obviously, we're not going to identify any child who does not want to be identified. But, just from their little hands and their little feet, we can actually see what we're dealing with here.
So this year, we are seeing a big difference from what we saw last year. Last year, as soon as the pandemic started, we put in our protocols, we put in our requisite drugs and everything. And we segregated the wards. And what we actually found was that we had wasted capacity because children did not require admission. Even if they did, they were very mild, and we really did not have to worry about them too much. Most of them we treated at home. This year, we are finding that almost every child who comes with a fever or anything tests positive. We are still treating many of them at home. We have a brochure that tells parents how to manage, and all those who actually get admitted are quite sick.
So you're saying that more children need hospitalization this year. It's hitting children harder. And the ones who come in more seriously ill than before.
For example, last year we had only one child out of 120 that had a bad pneumonia. This year, since 1 month, we've already have 4 or 5 with very severe pneumonias. You can see there's a ventilated boy out there, and we are in trouble this year. And this year we don't have any wasted capacity. We are now, 100% capacity full.
And how many children are here in this COVID wing of the hospital?
About 14 children right now.
So 14 children requiring hospitalization, and I can here, of course, see a trolley of medicines, of odds and ends. But basically, what I want to ask you is, how many children are at this point requiring a ventilator?
2 are actually on a ventilator, and there are some on oxygen.
Okay, this even for someone like me who feels I'm quite hardened by everything I've seen, this was a really tough report to do, and I want to come to you, Gurcharan. It just seems to be criminal to see this happening to babies, to children, and then to see these election rallies, to see politicians squabbling, to see states competing. It is unconscionable. It is unconscionable, and yet we can't get everybody to come together. We just cannot do it.
What the doctors have been saying. I think, as Dr. Joshi said, mask. That's your best solution right now. And as a nation, we have to go after vaccination in a massive way. We debate too much, and I think. Frankly, I wish that things you've been showing on this program, that the sentiments that have been expressed by the doctors, I mean, these should become the refrain on all media.
So why isn't it happening, Gurcharan? Why are we still a divided nation? What is going wrong with our message?
Well, the argumentative Indian, if you will, that may be one feature of our character. But no, it's not just that. I mean, I'm against national stereotypes. Really, it's governance at the deep down there. That you have to recognize that we are in a national emergency. And I hope now, with all this in the last few days, the country has recognized. I mean, these whole pictures of the election rallies going on, and the Hardwar Snan.
Sorry, I don't know. We lost you there. Yeah, you're back. Yeah, go ahead. Yeah.
All this, I hope, should have woken us up to become one nation for a little while at least.
Dr. Dhurv, last thoughts, sir?
As Dr. Shashank rightly pointed out, I think I'm not mute. Yeah. Dr. Shashank rightly pointed out, India has got priority for everything. Politics, religion, tradition, culture, everything comes before health. A simple, non expensive way of preventive COVID is not being thought about. Suppose there is a marriage in our house, we forget everything about COVID and start enjoying it. Politics, we start enjoying it. Cricket, we start enjoying it. We forget everything about the mask. A simple double mask, which probably avoiding closed meetings, probably would save 50% of COVID infection. But very rightly said, even after 1 year of COVID, couple of years of COVID, or more COVID like infection, we are not going to change our priority. India would continue to behave like India has been. So, despite all our efforts of asking people to use the two masks, people are not wearing masks. Even our politicians are not wearing masks while attending a rally. It would have been so simple. Whenever a politician is addressing a rally, he can start with a simple thing: everybody wear your mask, and the message would go. Even these simple things are not being done. So I believe this would continue. Probably will come out of COVID within 1 month, at least from this episode, or a couple of months. But again, something else would come, and we'll go on debating. Thank you, Dr. Mike.
Yeah, and life, I don't know if it's that life is cheap, but Dr. Joshi, we must look globally. We must look at the fact that United Kingdom and the United States of America, Israel, we do have countries. I don't know if there'll be a third wave or a fourth wave, I don't know. But at the moment, their vaccines have managed to push them out of the age of hospitalization. Their restaurants have opened outdoors. There are things you can do. If airlines can be asked to leave the middle seat vacant, rallies can also be, if they must be organized. I mean, I think it's idiocy, but if they must be organized, you can have one chair left. You can have the politician on stage saying, mask pehno.
Where there is a will, there is a way. And I think we need to learn from East. I would not look at the West at all. Look from Japan, look from Thailand, look from Vietnam, look from Taiwan, look from China, look from Korea, look from New Zealand, look from Australia. They have beaten, and look from Singapore. They have beaten COVID heads down. They have been disciplined, they have masked, they are quiet, they are silent, they are obedient. COVID is a zero tolerance virus, and you have to obey it. There is no respite for it. Unfortunately, as Gurcharan said, we are so argumentative, so rebellious, so revengeful that come what may, we take it for granted. And I agree with Dr. Urman through completely that we have just taken it for granted. And we clearly will have a third and fourth wave. We have to ensure that we at least take out the sting of that third wave.
Yeah. Dr. Velumani, I had a doctor on this program yesterday who said, forget nationalism, India needs international help. Do you think we're at that point right now that we can't do this alone? We're too late for the second wave. We need to be better prepared for the third. And we need help.
Barkha, it was just 8 weeks back. It looked all over. Now it looked like very, very big monster. 8 weeks. It looked like 8 weeks back, we will be the world's largest vaccine exporter. Now it looks like we will be the world's largest importer. I must tell you, until the virus goes, egos should go.
Well said. That's short and unsweet, bitter pill that needs to be swallowed. Dr. Satwik, what's leaping out at us that we're still ignoring? Is it that we don't place value on life? We're such a big, humongous, populated, diverse, almost unmanageable country. I mean, Gurcharan did make a reference to it being a governance crisis.
Well, yes, I think something to consider was that children under the age of 15, 16 constitute a third of our demographics. 1/3 of India is under 15 or 16 years of age. And because we had kept them locked up, they were essentially virgin soil. They were naive to the virus. And it was just a matter of time that infections would start creeping up in the young and in adolescents. So we definitely need a blitz as regards vaccination. Don't get me wrong, I've been one of the most abiding and completely fanatical votaries of vaccination. All I'm trying to say is that to actually find out if vaccines are working and how well, we need a registry of post-vaccine infections. because you might need to recalibrate your strategy about which vaccine to use. Because I gave the example of Brazil, they've been extensively using Sinovac, and because it's not efficacious, they'll need to change it, because even the FDA definition says if it's not even 50% effective in preventing infections, then it's not a vaccine technically. But I'm saying that we don't know, and in order to know that, we need a registry. And I think the first steps have been taken, because now every time you take an RT-PCR test, you have to tick whether you've received the vaccine, how many doses, and when was it done. So let's do this scientifically. Clearly, respiratory mucosal pathogens usually have a tripartite wave pattern. So there's a small first wave, there's a massive second wave, and there's a third wave, which is intermediate between the first and the second waves in terms of intensity. So it's entirely possible that there might be a third wave on account of the variants, and we have to be prepared for it. So it's the old aphorism that if you sweat in peace, you don't bleed in war.
Yeah. I just don't know what it will take for people to come together at this moment. I think someone said on this program today, Gurcharan, maybe, that if COVID can't do this, I don't know what will. We'll have to leave it there. Dr. Velumani, Gurcharan Das, Dr. Joshi, Dr. Satwik, thank you. And I just want to again leave. This is a disturbing video, but I leave our audience with it, because maybe this will make you think that this, God forbid, could be your baby or the baby of somebody you know. And this is an 18-day-old child struggling for life in an ICU. So please, for God's sake, if nothing else, if you can't get the vaccine, you can't get oxygen, you can't get remdesivir, wear your mask. Wear your mask. You can do that. That is within your control. Nobody can take that away from you. Nobody has to give it to you. You don't have to wait for governments for that. You can do that. So thanking our panel and leaving our audience with this image. A 18-day-old child on a ventilator in a children's COVID ICU. It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.